All right. So in this session, we are dealing about the important questions related to the INI-CT pattern that we conducted the quiz. So if you look at this question number 1, here we have a 15-year-old girl and the vision is 20/30 in the left eye, and they have shown you the CT scan. And they are asking what is the most unlikely finding. So if you look at the CT scan, what is the finding here? Can you see here? What is this finding? This is actually the fusiform. The fusiform enlargement of the optic nerve. This is the fusiform enlargement of the optic nerve here. And this fusiform enlargement of the optic nerve is actually found in the optic nerve glioma. This is found in the optic nerve glioma. And what is the typical name of this sign? Hello, Elsie. What is the typical name of this sign? So this sign is actually called as the railroad track sign. This sign is called as, good afternoon Bunty. So we are discussing the important questions here, which are INI-CT pattern questions that we had given you in the quiz last evening. So this is again an important question where a girl is presenting with 20/30 vision and CT scan has been shown to you. CT scan is showing you the fusiform enlargement of the optic nerve, and this sign is called as a railroad track sign. Now this optic nerve glioma, where it is found, so this is a very common finding. Actually I did not want to talk about it, postponement, and yeah, actually I know Supreme Court has asked to postpone the examination at least for 1 month, and we are awaiting for the AIMS declaration. But actually anyhow we have to prepare maybe after 1 month. So maintaining the continuity and show must go on. So I don't want you to feel complacent and get away from the studies, lost into the track, because coming again to the track is very difficult then. So let's discuss the questions. Yes. So what is happening? This is actually very common in the cases of the neurofibromatosis 1. So with respect to the neurofibromatosis, what are the things that you can find? Number 1, pigmented iris lesions. Yes, we can find the pigmented iris lesions, that is called as Lish nodules, and it's a autosomal dominant condition, so brother can also have a same problem. Then propensity to develop the central nervous system tumors, yes, this is also there. So answer to this question is good vision after the surgical resection of the lesion. So that is not a probability, because as you know, this girl is having a optic nerve glioma, and optic nerve glioma have a fusiform appearance on the CT scan, right? So when we have this sorry, this is not called as a railroad track sign. This is a fusiform enlargement. Railroad track sign is found in the meningiomas. So this is a fusiform enlargement which is found in the optic nerve gliomas, and this is found in neurofibromatosis 1. You can have the Lish nodules, you can have the optic nerve gliomas and neurofibromatosis. You can also have the central nervous system tumors, and this is autosomal dominant. So pigmented iris lesion is there. Then brother can have the same problem, and we can have the central nervous system tumor also. And most commonly we are actually resecting it. We have to remove this optic nerve. So obviously when you are removing this optic nerve glioma, optic nerve resection will also be